Now, the GMA Health Alert and a new study released overnight raising concerns about binge drinking and stroke risk, especially among younger adults. Our Chief Medical Correspondent Dr. Narula joins us now, and Doc, break down the study for us.
More and more, Michael, we're talking about the harms of alcohol, and in particular, excessive alcohol. So this was a study where they looked at 1,600 people who were admitted to Mass General Hospital with intracranial hemorrhage. That's a bleeding type of stroke, the most deadly type of stroke. And then they basically broke them down into two groups. Those who were heavy alcohol users, which meant more than 3 drinks per day, versus those that were not, meaning they either didn't drink or drank less than 3 drinks. When they looked at those heavy alcohol users, they saw that on average, they had larger size bleeds by about 70%. They tended to be about 11 years younger, so in their 60s as opposed to in their 70s. Twice as likely to have deeper brain bleeds that extended into fluid-filled spaces in the brain, which is considered a complication, longer hospital stays, more likely to go from being independent before their stroke to then being dependent and needing assistance. And when they looked at the small vessels in the brain, there was more advanced small vessel disease and damage to the white matter of the brain. So really more and more information that really points in the direction of, once again, alcohol, but now with a harm with this particular type of stroke, which we don't often talk about, the intracranial bleeds.
We also have the links to cancer.
Exactly, George, and that's a really important one I think a lot of people don't think about, but alcohol is associated with cancer. In fact, about 7 types of cancer. So when you think about your whole gastrointestinal tract, from your mouth to your pharynx, your esophagus and stomach, colorectal cancer, liver cancer, and then breast cancer. And that's an important one because with breast cancer, even any amount of alcohol, small amounts, have been linked to it. We think that really the alcohol causes cellular damage. It changes how we absorb nutrients, how we react to toxins, raises our risk of obesity and hormone levels like estrogen. All of this really fueling cancers, but again associated with things outside of cancer too, George.
So what is the recommended approach here?
Yeah, well, the recommended approach per the American Cancer Society and many others is to abstain from alcohol. If you choose to drink, then the recommendation is to drink in moderation, and that means 2 drinks max a day for men, 1 drink max a day for women. When you talk about what a standard drink is, it's 12 ounces of beer, 5 ounces of wine, 1.5 ounces of liquor. So really important to be mindful of this. And again, you know, outside of cancer, it's important to point out risk with other types of cardiovascular disease, liver disease, pancreatitis, psychological and mental health issues, violence, sexual assault, risky sexual behaviors. I mean, the list goes on and on.
Yeah, it really does.
Yeah.
I know, and some people we try and make light of it, but this is really a very serious situation.
It is, and so often, you know, I ask my patients, how much do you drink? And I think people think, oh, 2, 3, 4, like it's no big deal.
Right.
You know, 3 doesn't maybe sound like a lot to a lot of people, but in this study, that was really that cutoff.
Yeah. Well, thank you for bringing that to us.
Yeah.
I really appreciate that.